Howdy and hello, and welcome to another edition of Human Experience Hangout. I'm grateful whoever gets to see this now and whoever gets to chime in a little bit later and catch it later. I don't think you're going to want to miss it. Currently, I have a little co-host that will be popping in a little bit later. Mr. Rick Ramirez will be joining us, but because there's so much to cover, I'm going to get started right away with our lovely, amazing guest. Ladies and gentlemen, Mr. Lawrence August.
Hello there.
Hi, Lawrence. How are you?
I'm good. There's a little delay from what your lips are doing and what I'm hearing, but hopefully that won't turn out to be too much of a problem. Can you hear me okay, though?
Okay. I can hear you. Is it still delayed? It wouldn't be a thing of mine.
I think it's sorting itself out. So
okay.
Yeah, I think we're good. And this is my inaugural voyage on StreamYard, so I'm excited.
Hey, cool.
Well, we're hanging out.
Well, don't let my methods of madness sway you or anything. It's a slow process.
It's all good. It's all good.
Well, as Mr. Rick pops in, the three Rick, Larry, and I knew each other back in Chicago back in the day. We made a feature film together. But from what I remember of you even back then, this is late 90s, you were always into health, your body, health, nutrition. Do you want to give a little backstory?
I'll give you guys a quick bio. Back then, I've known you now, Heidi, 20 years. So if you go back, back into the 90s, it was really like sports nutrition and anything else that a 20-something young lad would be into. And then through the years, leaned more toward holistic nutrition. Ended up landing a gig at the Center for Integrative Medicine, which is in Tarzana, California, out here. It's the busiest private solo practice in Los Angeles. While I was there, I conducted a little over 8,000 consultations. Center's run by a physician named Dr. Michael Hurt. And very unique situation over there to kind of give you an idea of the practice. He was an MD, so he's a real doctor. He could write prescriptions. What we offered patients was interesting because we had a natural pharmacy at the center, and essentially, well over 300 products where, if
a natural pharmacy.
Natural pharmacy, yeah. So if a patient, if it was appropriate and the patient wanted to try, something instead of a prescription, we could offer that. And while I was at the practice, I sort of co-managed that and was part of formulations, bringing in new products, even named some of the products over there. But it was a great experience. Then a couple of years ago, I kind of went off on my own, and the last couple of years, put my focus into children's nutrition. So got certified in youth nutrition. So certified youth nutrition specialist. I've been involved in there's my website popping up, kidsgethealthy.com.
It's so epic.
I've been involved in one of the nation's leading nonprofits since 2007 called Accept the Challenge. So operationtoneup.com. After the show, we could probably, on Facebook.
Yeah.
Once we have this, we could do show notes and everything we talk about today, we can put links below. But so I'm involved in that and just, a busy boy. So that's
a busy boy.
That's kind of my deal. Yep.
That's awesome. Well, I know Rick wants to jump in and say hi because we both had a couple of questions for you before you start rolling on all your fantastic intel. So Ladies and gentlemen, Rick Ramirez, I know you can hear me. Ladies and gentlemen, Rick Ramirez in the house.
There he is. Coming in hot.
He's coming in hot. So cool. Okay, now I can try this thingy. Let's see if that works. Nope, not at all. Oh, it'll be like that. When you talk, there you go. All right. We'll go back to this one for now.
This is legit.
Ooh, this is funky.
Wow. This is legit. This is way better than Zoom.
And I know, like you said, there are features galore. If you saw how long it would take for me to even get this dang mic on, let alone this little, it's process. And now we lost it. Okay, cool. Howdy, Rick.
Hi.
We're happy you came back.
Are we live?
We are live. Is that cool?
We're streaming, brother.
Put your pants on. Oh, you don't have to, actually.
Well, the reason, because I'm asking, I apologize for being late. I had a migraine yesterday. It decided to visit me again today. It's like not.
Oh, I'm sorry.
Day.
Maybe we could talk about migraine management today.
Yes.
Amazing.
Take it away, Larry.
When we cover everything we need to cover, we can do a
when we go into that. Well, we're happy you're here because I know he's got a lot of intel to drop and to talk about, especially because of the last year of the plans, scams, and automobiles. So if you have any questions, pop in, Rick. I'm just happy you're joining. Reunion.
I didn't want to miss the show.
I tried. Yeah.
And you gave me heads up, and I'm like, I'm gonna
everybody,
go.
we were on the phone call yesterday. Everybody didn't get to see those truth bombs, so it's gonna be amazing today.
Yes.
I'm just gonna spit hot fire.
Yeah. How do we even start with this? I think everybody's quite aware of the scam plan. No. How would you?
Let me. I just heard Larry introducing himself. He's got a lot of qualifications. Let me just tell everybody. When all this nonsense started last year, Larry was dropping little nuggets online, just letting you know, hey, maybe you should look into this information.
Before even Trump.
Yeah. Mm-hmm. And it was one of those things where you kind of you picked up on the info and you're like, oh, we're not being told the right story here.
Yeah.
So we're very lucky to have somebody like Larry on Heidi's show today to drop little nuggets. But I think these little nuggets are going to be like, are they called M80s, those firecrackers, the big ones? Boom.
Moab?
Moabs.
I got to make this public.
And just so everybody out there knows, they're calling me Larry, but this is kind of like a Robert De Niro thing.
That's right.
Only certain people can call me Larry.
Only certain people can call him Larry.
Bobby.
We'll call him Mr. August today.
Bobby De Niro. All right. So, yeah.
Yeah. Lightness aside.
Ready to do it.
Let's hit it.
Okay. So I think, when it comes to the sort of big topic of, call it C19, there's obviously a million subcategories that we could go into, but I thought today we could keep it pretty focused and tight. We can go back a year ago, like Rick was saying, sort of where this all began, and hopefully I could take you all, anybody watching, listening, on a journey with me of how I came across particular information and got me thinking about what was really going on here, and I really want to distill it tonight into some really key things to think about, that if you just understand a couple things, you don't need to know 10,000 different things. The chain is as strong as its weakest link. And so when you are looking at that, when you discover that certain things are true, then everything else kind of comes undone. Mm-hmm. So that would be, I think, my focus tonight, and that's my aim, is to make a good case of my point of view. So if we go back, just kind of take it back when this all started. News broke out of China. To be quite honest, I would love to say at that point I was like, oh, this isn't going to be anything. I was really scared. Can I swear or not swear? Oh. Anyway, sure. I was scared shitless, honestly. Okay. Well, one, I wasn't for sure that this thing would jump over the pond. I figured it was going to end up contained over in China, but when that looked like that wasn't going to be the case, I was like, this could really, really get bad. And so that's kind of where I was coming from. I didn't come into this thing super skeptical, like, oh, come on, this is just BS. Like at the beginning, I was legitimately concerned. Seeing things going on in Italy, I was like, yeah, this is major. So my interest was, let me find out everything I can about what's happening here. Yeah. And when you have a novel, meaning new, virus in the world, you're left with now the scramble for treatments. Okay, this is important, and that's what tonight's going to be all about, is treatments, right? What can we do? Okay, so when it finally made its way over to the States, it just got really ugly real fast. It was people being, I mean, physicians were basically told there's not much you could do. Give them some anti-inflammatories, tell them to hydrate, go home. If it gets worse, they end up in the hospital, and they end up on a vent, intubated, and 90+% of these people were dying on these ventilators. So that was bad news, and that's not how you want to go about medicine. And so in that scramble, you start looking for what kind of treatments were popping up, and what was the global community saying of what were they using. Now, there's sort of two camps of medicine. That's important for people to understand tonight. Is in medicine, you have bedside medicine, let's call it, doctoring. You're a doctor, okay? And then you have your sort of science, clinical trials, NIH, and then you got the, different regulatory bodies, FDA, CDC, right? That's all part of it. But physicians on the front lines historically have always been kind of trusted to use their skill set to treat patients, okay, with whatever they feel could work. And really, you have an obligation to, one, first, do no harm. And two, if you understand that there's a treatment that is working, you're sort of obligated to follow through with those treatments. So that's important to this setup. And so at the time, there was, some positive reports coming out of France and Asia on hydroxychloroquine, right? The H word, right? And very early on, I was like, okay, this looks cool. And you start looking at the mechanism of action, how this thing works, starts to make sense. You're like, okay. Then news broke out in New York. There was a physician upstate New York named Dr. Zelenko who was treating patients really effectively with a combination therapy. And this is what really got me excited. Because here's a physician, he's right there, his phone number, you can call the guy's office. He's a real guy, doing medicine on the front lines. And so it was right around that time I got on Facebook, I did a live myself, and just sort of was really gushing about what I felt could be a real, sorry to say it, game changer, right? Yeah. And now it was because it was...
I'm sorry to interrupt.
Right around
okay. When was that?
When I found out, when it sort of all happened right around the same time, I was like, my insight into hydroxychloroquine was a little bit before Trump had brought it up in a press conference. So by the time I went to the live, that was already happening. I think we had less than 300 deaths in the state, but I knew real quick it was like, okay, the press is not going to give any legs to this. This is gonna get ugly very fast, and how this is gonna get reported. But what impressed me was the plausibility of how it would work. Hydroxychloroquine opening up the channel of the cell to get zinc into the interior of the cell. Basically, zinc has a hard time getting into the cell, so it's an ion, and it needs what's called an ionophore to get into the cell. And hydroxychloroquine is really powerful, and it kind of opens the door up. And we know that zinc has some antiviral properties. It can basically stop the replication. When you have a situation like COVID, I mean, we know a lot more about it now, but you've got to really kind of act fast in that viral stage. It sort of goes through 3 stages: viral, respiratory, and then thrombotic, right? When you get into blood clots and these kind of things. That all makes sense so far, right? So you really want to treat early. This is the key. Like anywhere in medicine, that's what you want to do. You want to treat early. We do that with every condition. I mean, the flu, you want to get on things right away. They use Tamiflu and different things in the outpatient setting. But the fact that they were kind of like basically telling doctors that they were SOL was really peculiar to me. So where can we go next with this? Well, anyway, other doctors started showing up on the front lines. Going to make this kind of fast. It was like, with same results. Dr. Robin Armstrong, a few others. We had a doctor here in LA that got on ABC News talking about it. I would love to link those videos, but they've all been taken down. It's on ABC News.
So,
and I was like, oh, this is interesting. Now, here's where it went, what I say is full retard, is that every physician that was saying this works was saying it needs to be done early. Well, they start rolling out trials, right? So here we got frontline medicine, and then we've got clinical stuff going on. I'm like, all right, they're going to do some trials. Let's see what happens. Every damn one of them was done wrong. They were giving this stuff in late stages in a hospital setting. They did a VA study with these people were like half dead. So the analogy I like to give is that, and this is important for how the press portrayed this. Imagine this now. Imagine you're in your house and the corner curtain catches fire and you got a glass of water and you put it out. Okay. You just put the fire out. Now, let's say scenario 2 is you let the fire engulf your home and you still have a glass of water and you try to put it out. It's not going to work. Now, imagine if the media put a headline that said, water found ineffective against fire, water linked to homes burning down, water linked to death. Maybe there were people inside the house and they died. I started seeing these headlines. This drug linked to death, leads to death. No, right. And one after another.
Yeah. The media really.
It was driving me crazy. So then I just started to look at around the world at what was going on in other countries, and more great reports from the ground. And that was probably, Rick, where you were just seeing me pretty much every day, and I had arrows coming at me from every direction, and I'm playing whack-a-mole with people. And in the meantime, kind of parallel to that, other treatments were being explored. Dr. Pierre Corey and his team were doing really, really great work on the front lines, experimenting with ivermectin and corticosteroids. Now, this was another thing that I saw happen. Dr. Corey got raked through the mud for putting forward the idea of treating the intermediary stage of the progression of COVID-19 with corticosteroids. I mean, literally just ridiculed to high heaven. About 6 weeks later, Oxford released a study saying that corticosteroids would be something worth looking at, right? So he was sort of validated, right? But 6 weeks later, you guys remember every day that was going by, this was just like, everything felt like an eternity.
Yeah.
So I just like, this is just ridiculous. And so now we know that corticosteroids are standard of care, because what we have is what's called organizing pneumonia in stage 2, where you want to pulse the steroids properly and this and that. And they're still getting it wrong. They use dexamethasone instead of methylprednisone, but whatever. We're not going to get into the weeds with that stuff. We will. I'm going to link everybody later on studies that you can look at and judge for yourself.
Yeah.
So anyway, working our way through that, you had all this going on where it was an uphill battle, a constant uphill battle. Meanwhile, we had drugs like remdesivir being brought into the limelight. And there was a moment that also blew my brain, was when Dr. Fauci's sitting there in the White House on the sofa there talking to the media with a big grin on his face about remdesivir being so great. Well, I knew that they had already had some junk studies and some things that really showed us some potential liver issues. And what he said was, we now have proof of concept. That was the thing. Well, when we looked at the data, I was like, okay, this is okay. But really? And when you look at these committees and the organizations behind these studies and who's putting what together, and you look at the boards behind this, and there's 12 people and 9 of them are from Gilead, the company that makes remdesivir. Like, this is starting to get stupid. Yeah. This is another full retard moment where I'm like, no, this can't. Yeah. What's going on?
Yeah. So
these were, again, this is a part of the discovery of going, all right, well, this is obviously they're not interested in they're just not curious. This is just not going to happen. So here would be a good time to talk about the difference between experimental drugs and experimental treatments. They sound the same. And this is another thing when the media does things that are true, like they could say a headline like hydroxychloroquine linked to hospitalization, like death. Like, that's true in the same way dumping water on a half-burned house is not going to work. That's true, but that's also misleading. Experimental drugs are not the same as experimental treatments. Drugs like ivermectin and hydroxychloroquine have been around decades and hundreds of millions of doses. In fact, ivermectin has been used close to 4 billion times. 4 billion. Hydroxychloroquine was given to anyone. If you go to the CDC website, it's still up there. You can get the PDF. Anyone traveling, right, to third world countries from yellow fever, for malaria, pregnant women included, children included. It says right there, who cannot take hydroxychloroquine? People with psoriasis, right?
That's so random.
And the side effects are things that people need to be on these things for a long time. Now, there's certain issues with cardiac patients, and you've got to monitor, but that's just good medicine like anything else. You would monitor those patients. You'd separate them out and do risk stratification. So this is the difference. The original intent for hydroxychloroquine was malaria, but it was doctors off-label prescribing it for lupus, rheumatoid arthritis. Those are autoimmune disease. Those aren't malaria. So when you see people go, how is a malaria drug going to work? Well, how does it work for lupus and rheumatoid? Why? Because physicians understood it had certain properties. A drug just doesn't have one property. It can do a lot of things. And it had immunosuppressive properties. Great for someone with autoimmune conditions, right? Hyperactive immune, if you will. Overdriven immune system.
Isn't it also like pennies a pill or something? Like,
it's extremely cheap, right? Yeah. Extremely cheap. These things are like, generic. And that's the other thing. People are like, is Trump going to make a bunch of money off this? It's like, there's no money to be made. And then they were complaining that the supply chain, people can't get it. And it's like, no, that was actually, there wasn't a shortage.
No.
There was a lot of regulatory issues going on. Things were being held up. Well, anyway, there's emergency use authorization that the FDA put out for hydroxychloroquine, hospital setting only. You just like hospital setting only. Now, keep in mind, what's important to know is doctors could have been using this all along, but doctors are people too. Reputation matters. Everything is politicized. There's this big cloud around this thing. Only certain doctors were willing to kind of go there. So you have to remember that doctors they're just people. At the end of the day, in terms of any doctor you can write an off-label prescription for Plaquenil, hydroxychloroquine. So the emergency use authorization was dead on arrival. That wasn't going to work. And anybody following it knew that wasn't going to work. And that's, okay. So that's, where else can we go? So here you are going, okay, meanwhile, people are dying. And they don't need to be. And meanwhile, we've got to march toward, we want to get the public vaccinated. And I'm not against that. Like, all right, if that's what we're going to do, then let's figure that out. And let's go to the studies and let's, take a look at what the actual numbers are saying. And I'm cool with that. So I don't know where you want to go from here, because we can, I'm at the point now where.
Where are you at the point at?
What I saw on the front line versus, experimental drugs. Let me just finish that.
Yeah, treatment suppressed versus the narrative. And
experimental drugs versus experimental treatment. Yeah. An experimental treatment is where you would use a known drug in a new way. And then you might want to run a clinical trial doing that. And clinical trials are important. But when people are dying on the front lines, you've got to do risk benefit. What are the chances that this person is going to die on the ventilator? Once they get to the hospital, and then what are the chances anything go wrong with this known medicine? Where something like a new drug like remdesivir or these others that are coming along, those are kind of legitimately experimental. And I'd say the same thing for the mRNA, vaccines. That's true. That's experimental. So any like these headlines talking about ivermectin and hydroxychloroquine as experimental drugs, that's not true. That's just a lie. That's not
They're
true.
old school. They're used for multiple things.
Right.
But it
so
messes
now,
with the stats then.
What's that?
It messes with the stats then. Weren't you saying just like with the curtain, there's a way that they were telling us, giving the stats of the data that it made the percentages, people hear 50%. And then
we could talk about that. Absolute risk. Jumping ahead a little bit, but we could talk about that. Yeah. Because I think, we got to, where the rubber hits the road is this. Bottom line. If there's a known treatment, if there's a known treatment that we know works against COVID-19, and not even a single drug, but a protocol, which there are, okay, you cannot have an emergency use authorization for a vaccine as long as there's a known treatment. Right. So that's important. That's kind of everything right now. Now, so we got a lot of momentum. So I think it's important, in a follow the money kind of way, to look at the two companies that are pushing these forward. Moderna and Pfizer. And now Moderna's never had they've never had a successful product. They've never had a product. They've never been able to get anything off the launching pad. So for one, we're expecting them to just come out home run right out the gate. Pretty amazing. So they've really, and they've been around for like a decade. They really need to, we need this to kind of, we need some cash. Pfizer, if you look at it just in kind of general with drug companies, is it takes 10, 15 years of development, right, for just about any drug, and vaccines are no exception. These things take a long time. And they spend a lot of money, billions of dollars developing these. And then when they finally get to the approval stage, they've got about 7 years. They got 7 years before that thing goes generic, right? Okay.
And don't you first have to isolate the virus in the first place? And that has never been done?
I wouldn't go down the road with that it hasn't been isolated, because they've established it. You can see it.
Okay.
Right. There's a lot of stuff out there. And I listen to anything. I'm like, oh, you can't isolate it. Let me look at that. But I don't buy that.
Okay.
But just knowing that, right? Because you got to understand, there's just a ton of money. It's just a lot that goes into this, and you got a kind of a window of time. Well, when you look at revenue over the last 10 years, Pfizer, for instance, 2010, they brought in about $65 billion. Okay. Now, the last 3 years, 2018, 2019, 2020, got 3 years where they were really not even able to really break north of 41 billion. That's a big drop. That's a 40% drop in revenue. They've got their stockholders to make happy, and these companies put forward projections and targets. That's important to understand. There's some good videos that really break all this down, but the quick version here is that there's X amount of jabs that they need to get out there to hit their targets. They're looking to do 65 to 70 billion this year. And about 26, 27 billion coming in the form of the jabs. That is a big coming at you.
It's how much per jab?
I think the retail 20, and then they get 10, it's kind of like that. That's like, so now we've got organizations like the WHO. So you imagine you're the World Health Organization, and you get donations. You get I think her name was Margaret Chan. She said, she's just having to kind of beg for money. There's a documentary on the Who where she's, the quote is great, but it's something like, we've got to beg for money. And then often when we get that money, what we are sort of expected to do with that money might not be in the interest of the World Health Organizations, which is really to make the world healthier, right? The problem I have right off the bat, I think they did great work for many years, decades, but whenever you centralize power and authority, absolutely, in a sense, that's absolute power, absolute corruption. It's just going to happen. And whether it's nefarious or evil or not, so what? You got pressure in that system. Now we know the number 2 donor to the World Health Organization is our buddy Billy G, right? Billy G, right? And it's a lot of money.
Yeah. And
it's pretty targeted with what that agenda is to get these jabs out there. So just knowing that. Now so you've got that option 1. Do we just move forward with that? Or we got these dirt cheap, rinky dink, right?
Proven treatments.
Right. And no one's going to make money. So Merck, this is a great example of this. You just got to read between the lines, because Merck were the creators of ivermectin. They had the patent. It's no longer on patent. So what is Merck doing? Look in the news. Look at the press releases they're writing. They're not too favorable of ivermectin. They're bashing the crap out of it.
Wow.
Oddly enough, they are developing their own antiviral that pretty much has some of the same stuff as ivermectin. You move a molecule over here or there. You just follow. And what I would say about that is,
people's expense.
How the hell is it that when you follow the science and you follow the money, they always move in the same direction? It's magic. It's like it never moves any other way. It's just sort of weird. That's just crazy.
Meanwhile, you have a wake of people that are just wanting an answer, and they're thrown into divide and conquer war of disinfo and manipulation and media lies. And it's like, but the cure is right there. No one ever would have to be sick or die. I just find that.
Look, it's literally right there. And look, Heidi, okay, you and I, we've lived out here for 20 years. We're in Hollywood.
Our armor is thick.
And through the time that you live here, you meet people, you begin to know them. And I've got some people that I know that have made it into the public eye, and I've seen how they've been projected in the public eye versus how you know them. And it's a production.
Yeah.
It's production. It keeps right. And the advertising revenue that goes into these legacy media companies, corporate media, right, is just a machine. You're not going to get away with. You're not going to kill a half hour talking about vitamin D.
But instead
that's just not going to. That's just not going to happen.
Used to be sex cells, and now it's fear cells.
Well, because when the internet came along, right, it just sort of fragmented everything, and people's attention could go everywhere, and they needed to use new tricks. Back in the day, you had 3 networks that could just sort of say what they needed, and in the 50s and 60s, people were like actually terrible to each other, and there was like actually like really, really bad problems with racism. And then, you flash forward to now, and they kind of have to pull you in with these stories. The media is a magnifying glass. It doesn't reflect reality. It reflects as a focused look at a chunk of reality.
Yeah.
And they say nothing is as big as you think it is when you're thinking it. So as long as it can get you thinking about it, it occupies a big space. And our natural inclination is to survive. If something might hurt us, any warning about that is going to occupy a lot of our space because we're meant for survival. And what happens is that, and any warnings about that kind of become more legitimate in our mind because they're supposed to. It's a prioritization of survival. It's evolutionary, adaptation that we have. It's like something might hurt us. All these other things that aren't hurting us, we can avoid and ignore. It's something that might kill us. Again, I'm an example. When I saw about, I was reading the mortality and this, I'm like, this thing is crazy. And then I learned, and this is the point, when you learn, you don't have to be a sitting duck. When you understand that this thing can be treated, you can relax.
You're right.
And now I'm a year in, and I'm just going to say, so I'm a year in, and I've helped hundreds of clients, and I've conferred with different doctors. And so, yes, anecdotal or whatever, but I haven't seen these things not work.
Yeah. Didn't you say 100% success rate with the doctor you worked with that uses it?
Yeah.
Uses the
well, he has his protocol, so I won't speak on his behalf, but I know kind of what he does. Yeah. And I will say this, and you guys can look back at my Facebook from last spring. It's all there. I got the receipts. I mean, my protocols, my natural protocols and prescription protocols, I did it. And I think, a lot of people need to apologize to me, but so that's where we're at. So when you kind of see now we're at this moment where now it's accelerated, right? I mean, this is also the language, this thing is rushed. No, it's not rushed. It's accelerated. It's rushed. Like accelerated sounds like it's science. Like you just put the warp speed. We're going to put it through the accelerator. Like what? These guys got their act together. Like, let me just say, coronaviruses have been around forever. It's not like people haven't been trying. Do you think that companies weren't trying? They just were kind of sitting on their hands for 20 years and they've never. So we have two things going on here. We've never made a coronavirus vaccine with many attempts. And we've never used mRNA in this capacity. So you have two things here. Like, I don't care what you say.
Yeah.
Now
the media though puts it in a shiny box, and that's all people want. They literally did everything in their power to push away and suppress and push out hydrochloroquine, ivermectin, all the things that could help. And they literally let all the airwaves be instilled about a vaccine agenda.
That's exactly what's going on. And, just because something is unproven doesn't mean it's been disproven. It's just language. It's just a lot of language tricks where they can be right, but misleading.
Right. Well, that kind of goes into India, doesn't it? Didn't you have a few? Yeah,
we can talk about that. But I think this would be a good time to bring up absolute risk and relative risk.
Oh, yeah.
Yeah, because this is big. And again, I, got the documents and everything that people are going to need for this article written by Ronald Brown called Outcome Reporting Bias in COVID-19 mRNA Vaccine Clinical Trials. And so what it talks about is the difference between what's called relative risk and absolute risk. There's a pretty easy way to explain it, I think. Imagine group one, they get the shot and one person gets an infection. Okay, so you have group one, they get the jab, and one person gets the infection. And then let's say group two is a placebo, they did nothing, and two people got that, right? So to make the numbers easy, got 100 in each group. First group, one person was infected, second group, two. Now, the relative risk is risk reduction from getting the vaccine to not is 1/2. That's 50%. It's a nice chunky number. So you could be like, it's a 50% reduction. That feels good. Like 50%, I'll take that. The absolute risk reduction, any guess?
We know the answer.
It's 1. I'm trying to get you guys involved because I feel like I'm just.
I love it though.
and Rick's just like sitting there, like, yeah, man. You just kick it back.
Well, so that it's more mind games.
But it's 1%. Well, it's worse than mind games because It's dishonest. I mean, look, and that
dishonest.
The look, and even the FDA says that, you know, there's certain guidelines for this, and that was the whole point of this report, is that they're violating FDA guidelines by doing this. And what is the FDA doing about this? When you put out a number like 95%, so what is that 95? So they say 95% risk reduction. Let's use Pfizer for example. It's 95% risk reduction. Mm-hmm. What is the absolute risk reduction? Any guess? It's 0.7. 0.7%.
You get that from? Now
that's what you get. Well, because we have a different number set. I gave you the first one was right.
100 people in the one. Yeah.
Right, because that was to keep things easy. When you start getting into 20,000 people in the placebo and 20,000 in the treatment, so we can look. Let me pull it up here. So I'm reading off my screen. So I got the report in front of me. So I'll look at the numbers from the trial. So the Pfizer vaccine, they had an N of 43,000. N of, whenever you read a journal, it'll say N of, that means number in that group. So we had 43,000 and some change. Okay. So what they come up with is a number needed to vaccinate, meaning how many people do you need to give the jab to save somebody from getting an infection? That makes sense. Like, how many people do we have to do this to before it benefits one person? So if you look at these numbers, so they split them up pretty evenly. I've got it on front here. I have to scroll. I'm sorry. But you had in the jab group, you had 21,700. In the placebo group, you had 21,564. So very evenly matched. So in the jab group, you had 8 people coming down with an infection. And in the placebo group, you had 162. So that feels significant. So 162 plus 8, right? You get a number there, 170, 162 out of 170, 95%. So that's where you get that 95%. Okay. Now, when you look at that, they have what's called a number needed to vaccinate, right? It's about 143 people. So every 143 people, you got a jab, one person gets saved from an infection. So now look, if you play that out over 150 million people, that's a pretty big number. But when you look at the infection fatality rate and you start doing all the math there, you only got 0.15% of people that are ever infected actually die. And that's also important to know the difference between case fatality and so CFR, how many people like kind of end up in the hospital or going to the doctor with a case, or people that are just walking around, they got it, nothing ever happened, or maybe they were just treated at home and it was never really reported. But from serological evidence, meaning how many people out there that they found with antibodies, John Ioannidis, I don't know if I said his name right, but one of the considered the top epidemiologists in the world, figured this out. It was about 0.15%. So bottom line is, when you get this small amount of people that are saved from infection, and then from that, how many of those infections actually get worse, and then from that, how many of those actually lead? You're still going to come out, like if you just take them at their word, you would still come out saving some people. But that does not, now you got on the other side of it, that does not take into account any possible issues with the jab itself. That's just assuming a straight shot. Like it's going to work, like it's perfect. That's just assuming a lot, actually.
Yeah.
More than I'm comfortable with.
I mean, I'm very uncomfortable talking about the whole vaccine situation in general because of the entire principle that there are proven treatments that work. That should end it all. That shouldn't even have to get to that level.
It shouldn't get there. And
remember, can I do 2 seconds ago? I wanted to share this really quick because my pal Abby Lynn on here, you just talked about the mRNA, right? See, I didn't know they were trying to get that passed for a decade, and they never could, and all the animals died. So they used the state of emergency to get it shoved through. So this has been going on.
Well, yeah, they're shoving it through.
The agenda.
And it's what's sad about that is exactly that. That's the whole point of tonight. What we should repeat it. There's a treatment, and if there's a treatment play by their rules, your rules, right?
Play by whose
fair.
rules? Oh.
Their rules, right? They made it. Hey, all right, go by your own rules. You made up the rules. If there is a treatment, you cannot issue emergency use authorization. Mm-hmm. Now, let's just say, because I like to take the other opposing, like, what would be the opposing argument to that? Like, be like, well, what would be the problem anyway? If, like, okay, let's say it gets approved, because that might happen. We're in the middle of a clinical trial, by the way.
I know.
This clinical trial is supposed to go on another 2 years. But they want to get this approved. So let's say that happens. Well, what would be the problem? Here's what's going to happen. Reality, right? 2 things. You're going to have vaccine hesitancy. You're just going to have that baked in. So, X amount of people just aren't going to do it. And then you have globally, you're going to have places that aren't getting it. And when they asked our buddy Billy G, would you be willing to just let these countries make, can you waive the intellectual property? No, can't do that.
Oh, he's given to
there's not given. No, nothing's being given.
Oh, yeah.
The question is, can we take the profit motive off the table? That would go a long way of establishing trust. Like, can we get these? We've got pristine manufacturing facilities in other countries that are ready and willing, if they're allowed, as an intellectual property, right? No. Can't do that. So you're going to end up with people. The point is, you're going to end up with people in countries that aren't going to have access. So even if this is an approval, and we can say, well, now it's been approved and they're able to do that. The emergency use authorization, though, for point one, that should have never been granted. But they were able to kind of push these other treatments along. And there's so much to that, but to the point where we're at now, where it's happening. So here we go, right? At this point, whatever, we do questions, or you want to, you got anything on your mind you want to talk about with this? But that's the deal. I mean, cut right to the chase.
This is my favorite little banner. Maybe my contact. This is just the cusp of it. Are there treatments that work? Yes. There's treatments that work.
Well,
there's
little asterisk.
Could be ended.
I don't know. We're gonna get like completely ripped off the internet. There is evidence. American Journal of Therapeutics meta-analysis. Right. So everybody, now we've got a year in. We've got randomized control studies, guys. We got observational studies. Got epidemiological studies. You're right. It's there. Evidence doesn't mean proof, by the way. Nothing's ever proven. In science, it's like, look, I actually, had to kind of move away from hydroxychloroquine when I started seeing ivermectin working better. I don't have allegiance to anything. I don't care. And the fact that anybody should care, like, what was frustrating me to no end was, why don't you just, why don't you get these doctors, put them on the hot seat, grill them with questions, make them look like fools if you think that that's what's needed. Right. Settle this shit. Have a debate.
Instead,
all of these doctors are saying, I will debate you anytime, any place, anywhere. I will go anywhere on any stage and talk about anything. I will answer any question. We would do this. Deny.
Denied.
Suppressed. Take your video off. Screw you. Shut up. Play nice. That's ridiculous.
Yeah.
There's something when you're over the target, that's why they don't like you.
Right.
If they were so full of shit, you'd be able to be like, you know what, let's just, for the good of the public right now, because there's this misinformation out there and disinformation and creepy people in the shadows. Right. Let's just get it over with. Get George Stephanopoulos to host the damn thing and get John Legend to do, right? Like, let's do this, man. Let's get Dr. Fauci out there. Let's do it. It's all like done through, it's chicken shit. It's done through this, these techniques that are just cowardly. Yeah. Because I'm not smart. You guys, everybody out there, internet land, I'm not smart, but I'm curious. That's all. Just be curious. anybody can see this. So the biggest issue hasn't really been people can't see this.
Right.
It's they don't want to.
Yeah.
They don't want to.
Well,
or they do, and their brain shuts down. They can't. It's too.
Well, it's the KGB programming, but they've also turned it into, people fighting against each other. It's a social thing.
Oh, yeah, now. As long as we could keep everybody fighting, that'll be great. Yeah, because
gaslight, peer pressure.
President, what happened to Occupy Wall Street, man? I thought we were getting somewhere. We had the Bernie Bros and the Tea Party people high-fiving each other. And I thought everybody was kind of like ready to take down the real bad guys. I thought we were about like knocking down big corporations and who was, and now we're just like, these people are like, oh yeah, let's go Pfizer. Like, dude, these guys are criminals.
Is it
like the actual criminals, the biggest fraud in history.
Yeah.
10 years ago, they were frauding the public. Yeah. Actual criminals. I thought we put criminals in jail. Mm-hmm. What about tackling white collar crime? Don't you get the people that were caught with the sin spinach? Ended up in jail for weed. Well, weren't we supposed to be about those people, getting those people out of prison and throwing all the crazy white collar maniac criminals into jail? I thought that was the point.
Well, wait, in all your studies and you studying all year, but also just diving in, are you
sounding very medical here?
Are you seeing the big global agenda though regarding this? And Billy G's event 204?
When you start, look, there's a lot of things where you're like, well, that was convenient. Mm-hmm. When you have event 201, which is on Johns Hopkins website, which is hilarious. Mm-hmm. Event 201 is on the Johns Hopkins website. Mm-hmm. I try to post it on Facebook without commentary. Just here it is. It's Johns Hopkins.
Did you get flagged?
Flamed.
Yeah. Do you know in the goodie bag of that event, which was October 2019, it was a CV virus plushie. And that was October.
Yeah, it was a little corona.
And the whole event was what would happen if we have biological war.
Well, it was in October. And then you had, at that same day, you had the ID 2020 videos. These ID 2020 videos were, by the way, were a couple years old. But October 18th, I want to say, 2019, that same day, they put them out on YouTube. The thing was all happening on the same day. You have to believe a lot of things. You have to believe in a serious amount of coincidence to think that this was all just kind of some dumb luck, random chance. Look, I will not, because here's the thing. Until I know something for sure, I'm not going to just act like, yeah, that's what it is. Right. But if you just put it together, you go, well, it certainly looks like that's what it is. It's acting like that. Quacks like a duck, walks like a duck. I mean, it really, if it was that, it sure as hell would look exactly like that. Mm-hmm. And it's so far not looking like anything other than that. So that's, use your brain with that. I don't, what else do you do with that information? But to me, it's just going with the known material, going with the known data, going with what is known. That breaks
data that's not suppressed. The data we all have access
to. Well, the data that everybody should be able to agree to. Mm-hmm. Where this isn't like what if maybe. This is just data. If you want to review this medication, ivermectin, and look at the evidence behind it, it's there.
Right.
It's there.
Yeah.
And so to me, it's just that's just super fun. That says it all to me, because what other reason? If it was really to save lives, I don't believe you.
Yeah.
I don't believe you. So everything else, you're suspect. Super suspect at that point. Everything else doesn't mean anything to me. Because look, we can argue about masks and lockdowns and all that. That's all. Those you could do entire shows. You do a mini series on this whole thing.
Yeah.
Is that if you you're going to win an argument about a mask or win an argument about a lockdown, okay, no. What's important is that these jabs are being rolled out and these treatments are being known and people aren't getting them and people are dying. And the thing that I can't hold in morally is knowing, I'm going to get emotional, knowing people are dying.
I know. I know. I buried my father-in-law not long ago, and God bless him, but this tiny little Polish town, they only trust doctors. So what do? Even using my Google Translate, I send them the doctors. I send them doctors talking about ivermectin, which they have. They're farmers. They have these things. Yeah. But coming from me is that one thing. I think I sent them the slew of evidence, but they had their own journey to take, and we lost them on the ventilator, and it did not need to happen.
It's terrible.
And I'm like, it's crimes against humanity in the millionth degree, but now we're going on a year of people getting sick.
You guys got a calculator right now?
Yep.
Pull up a calculator. Okay. So what are we at right now?
Rick. You do that.
Okay. So what are we at right now? What's the death cult count? No, I want to know what are they at now? What's the
oh God, I don't
C19
hang on.
Leaderboard?
The murder, the genocide? You mean the genocide numbers?
This is I can't. I laugh, but I'm dying inside over this. It's horrible.
I know, because no one needed to. Everyone could have been safe at home, taking care of themselves easily with these easy treatments, out of pocket. Boom.
So I think we're close to 600,000. So let's just do that, Rick. I think we're at 600. Let's round up. I think it was like 590, 600.
Well,
so
I'm on the propaganda website called Google, and they're giving me the numbers right now. I gotta wait. They got a nice little they got a nice little chart going here.
Yeah. I'm surprised it's not like red and strobing.
Right.
Like dying. I mean, no disrespect, but I'm trying to not get agenda driven now. Proven.
Go to the end. Okay, so in the States, here's the number. In the States, it says COVID-19 deaths, 583,685. Okay,
so we'll be hitting 600 soon. So let's just say 600. Like, so type this in: 600,000
murders
times 0.85. So
510,000.
Okay. That's how many people we could have saved.
Oh, yes, with the percentages.
So when we look at, if you look at now, it's pretty solid, about 85% reduction in deaths. And who knows? Let's just say, and that's if, that's if just what we know. I mean, had this stuff been really adopted en masse, what you would have, it would probably have gotten better, because the more teams, medical teams, clinician teams that are working with protocols and are able to feel comfortable about doing it, they're able to share. So thankfully, Dr. Corey and his team, they're called Frontline COVID-19 Critical Care Alliance. Again, we'll link all the stuff later, show notes and all that. But his team, they were able to really kind of come together and put together really beautiful treatments and continually update them. They continually update them and modify them. So can you imagine a country that was really mobilized on the front lines, able to feel comfortable and free about doctoring, being doctors? Mm-hmm. Just these things would probably gotten better. We'd probably be over 90%, 95% of, and the word would get around enough where people, because again, these are patients that were coming into this a lot of times not knowing that they need to get in right away. So anybody out there, right, it's got to go in fast. The beauty of ivermectin, it seems to be effective at all stages, but it's always better to go in early, right? So all of these things, it just drives me crazy to think that 500,000+ people in our country alone, do that math, Rick, on what are we worldwide? 3 million? Rick, you're going to be like Jamie on Rogan. Rick, pull that up.
Pull that up, please. What's that number?
Can you pull that up?
Let me go through my notes.
Well, here's the thing: they're not giving all the countries. They're just kind of rounding out the numbers, and they got, of course, the United States at the top of the list. And this is the number of deaths, but the actual number based on the math
So on the number of deaths worldwide.
Worldwide?
Yeah, I think it's like 3 million.
Let me see. Worldwide.
And then on India. The India Pfizer thing.
Oh, yeah. Yeah, we'll get into that. It's about to get real good, folks. We just turned a crucial corner.
I gotta move my contact. I love you, Sue. Hi, Sue.
We're good, though. We're at about an hour, Heidi. We're good, because
Yeah. I mean, I know if attention spans and things, and, you know, maybe if we hit 1:30,
Well, you know what? The good thing about it is we have a recording of this. We could chop this up into segments.
Yes. So it's up to you in that sense. And yes, I have a recording. And Rick taught me how to send it.
So we're like a motley crew right now.
But it's perfect.
What is it, Rick? So let's do 3 million. 3 million times 3 million times 0.85.
Okay, I want to know where you're going with this, because this is
my
heart's heavy.
This is how many people we could have saved. That's what Larry's saying.
Oh.
Yeah. I'm sorry. That's what Mr. August is saying.
Yeah.
2.5 million.
Yeah. You know, you're talking. I mean, it's just talking about crazy numbers that. So we could go right into India, because here's where the rubber hits the road, as I said earlier, and where people should start paying attention, because I'm going to make some predictions of how this is going to go. What's that?
Oh, people who watch Middle Square. He's been right all along for a year.
Yeah. Look, I might end up wearing egg on my face, but
you shine so bright, doll.
I don't care. I just don't care.
Shine your health.
So what's happening? Back to money. Part of the goal to 70 billion for Pfizer is India plays a crucial role in making those numbers happen. Why? Because India's got 1.4 billion people. Now, suddenly, out of nowhere, you saw some crazy stuff coming out of India. You know, they were doing really, really well. I think it's important for Americans to know that India is not just this kind of one big monolith of people. I mean, the caste system is still very much alive. There's separate states in India. These separate states have their own politics and their own policies. They've got a leader who's controversial. The media, it's similar to Trump. The way that they kind of depict him, and
they love Trump, though.
So you've got a situation where Pfizer has to get that account. Imagine they're like a salesperson, like a pharmaceutical rep, and you're like, I gotta have this account. You know, you're gonna keep hitting the phone and calling up and, when can we do business? You know, this is really what's happening. And so just recently, the CEO of Pfizer I put the video up on my Facebook in the comments of one of my posts, but he just went on and was basically saying, we are donating out of the kindness of our big pharma hearts, 70 million, well, a retail value of 70 million. I mean, who knows what it really cost them, but they're going to be donating 70 million in humanitarian aid to, and it's important to watch. When you watch this video and you watch it over and over again, I mean, it literally is like a really well-crafted bit of salesy propaganda, because it's sort of the order of things he brings up. And he's basically dangling a carrot, and he's playing the media. We're going to give 70 million and antibiotics and, first line of care kind of stuff and all these things, right? It's like, well, what about ivermectin? Oh, wait, you can't say that. That's not going to work.
Wait, who said what about ivermectin?
He didn't say anything because he's the CEO of Pfizer.
Okay.
He wants ivermectin to be banished off the face of the earth, for Christ's sake.
Mm-hmm.
So by offering this goodie bag to the people from his benevolent heart, then he goes on to say, it's really a shame. We filled out our paperwork for approval of our mRNA vaccines, and it's really a shame. I mean, you guys haven't approved it. So now there's going to be public outcry to the leaders, why are you holding back the people of India from this jab? And it's going to get, so my prediction is you're going to see it revved up. It's going to get real revvy and real frothy.
Yeah.
Now, the United States media, you're just going to be bombarded with blood and gore. They put pictures from India that, you know, when you look up the photos, you do a reverse image search and it's like a picture from like a gas leak like 3 years ago. They just keep whatever they do. They keep trotting out this.
Yeah.
Not saying it's not bad.
Right.
But here's the good news. Okay, go to the Indian press. And then again, they're like separate states. So just like how we have here, we got Ohio and Illinois and California and Texas and Florida, like in every state's, right? It's no different. So NPR doesn't get to speak on behalf of the Indian people, right? No less than we should ever expect CNN or Fox, for that matter, to speak any of these. Right? Boots on the ground, people are there reporting. They've got independent reporters too. They got their own, right? It's their own ecosystem. You got to get into there. You do. Don't be lazy.
Right.
Now, when you go in there, here's what's going on. People of the earth. April 22nd. So now we're like a few weeks, 13, 18, 3 weeks now. April 22nd, the Indian Ministry of Health issued basically saying, like, you know, ivermectin can be used in different settings and sort of giving some freedom to employ this. Now, in areas where the politics aren't getting too much in the way, it's already happening. I sent you guys through direct message the graphs, the charts. I like my charts. I like my data. You know, right? Here's the data. Look at the data. Look at the curves. One after another, cases and deaths are falling off now.
Because of?
Ivermectin. It's happening.
And so zero again, media.
As I said earlier, let's just say they land their account, India gets it. There's still going to be places over there, I can guarantee you, that aren't going to have access to the shot if they want. So again, even if you're pro, even if you're for it, even if you're just a compassionate human being, shame on you for not taking 10 minutes and looking at and reading the study, American Journal of Therapeutics. Shame on you. Like, look at it.
Yeah.
Because why can't we have choices? Why can't we? Now we haven't even begun. Okay, now we haven't even really begun going into what potential problems with the shots or anything like that. I mean, there's I think maybe like 2 or 3 things that should get people, like even the most skeptical, even the most like no. There's 2 or 3 things.
The VAERS report, people have access to that. They don't look it up. Where there's risk, there's
VAERS. I would say there's VAERS. I wish it was better because it's the only thing we got.
It's the only thing we got. Yeah.
It's the only thing we got. I wish it was better. I'm going to say this about VAERS. You got a ton coming in. Some are going to be, I'm getting an echo. Some are going to be terrible and bogus. A lot of them aren't. But it's what we have. And that's absolutely, you got to look at that. Like really, really important to look at all that stuff. And I wish it was better set up and designed. But let's put like VAERS aside. What I would love to call attention to, let me get so there was a letter, urgent open letter from doctors and scientists to the European Medicines Agency regarding COVID-19 vaccine safety concerns. Okay, and it's a series of questions. May I read some of these?
Yes.
Yeah, okay. So this first one I want to kind of drill in on because it's a key one. Following intramuscular injection, it must be expected that the gene-based vaccines will reach the bloodstream and disseminate throughout the body. We request evidence that this possibility was excluded in preclinical animal models with all 3 vaccines prior to their approval for use in humans by the EMA, European Medicines Agency. So there's several questions, but let's just talk about that one right now. I'll pull up my document. Where is it? Okay, here we go. So what they're concerned about is essentially concentrations of mRNA and what they call lipid nanoparticles kind of moving away from the injection site. We're supposed to believe that it all sort of does what it does at the injection site and nothing gets into the bloodstream, nothing ends up in other parts of the body. Mm-hmm. Now, so there's a report from European Medicines Agency dated March 11th, assessment report. It's a 169-page report. Page 47, quote, verbatim, follow along, kids. So LNP, by the way, stands for lipid nanoparticle. Concentration of mRNA 1647 were quantifiable in the majority of tissues examined at the first point collected, and peak concentrations were reached between 2 and 24 hours in post-dose in tissues and exposures above that of plasma, besides injection site. So this was that letter of concern. That was one of their issues. There's several, but this is one, and it's a key one. Besides injection site and lymph nodes, increased mRNA concentrations compared to plasma levels were found in the spleen and eye. Both tissues were examined in the frame of the toxicological studies conducted with the mRNA 1273 final vaccine formulation. Low levels of mRNA can be detected in all examined tissues except for the kidneys. So this included heart, lung, testes, brain tissue, indicating that the mRNA and LNP platform crossed the blood-brain barrier. There you go, although to very low levels. I don't know if you'd want any levels. Liver distribution of mRNA 1647 is also evident in this study, consistent with the literature reports that liver is a common target of LNPs, lipid nanoparticles. So this, again, here is going to highlight the concern that the letter that I read from the doctors about these vaccines is that, in short, that undesired spread of the RNA and LNPs throughout the body, they get taken up by what's called endothelial cells. Those are the cells on your blood vessel lining. And this could cause those capillaries to begin to express the spike protein, or manufacture the spike protein. That's what the vaccine does, but it's supposed to do it at the jab site.
Just the jab site.
Not like somewhere else.
Yeah.
And what's going to happen is those capillary linings express the spike protein, causing an immune response against those tissues and those cells.
Okay.
Does that make sense?
It's what we're seeing now, right?
Well,
yeah.
So with VAERS and the things that are kind of coming up, blood clots and bleeds and brain bleeds and strokes.
Yeah.
It kind of makes sense, right? And the other issue with the spike protein, and I'm going to read you something from this writer. So people had concerns about spike protein. This is just a little excerpt I found in an article that just makes me you just want to slap people when you read stuff like this. Someone is saying, can the spike protein cause any problems? No. Spike proteins line the surface of the severe acute respiratory syndrome coronavirus, which looks like a spiky massage ball, but it shouldn't be used as one. The spike protein helps the virus enter your cells, but the spike protein itself is not supposed to make you sick. Here we go. Here's the money shot. Claiming that the spike protein alone is responsible for illness would be like claiming that a bleached blonde wig with frosted tips alone can cook like celebrity chef Guy Fieri. So it's a real smart ass. This is a real smart ass. This is a science writer or someone for, I don't know where I even pulled that from. All right. So this is what this guy says. A month later, Salk News, right, reports the novel coronavirus spike protein plays additional key role in illness. And let me read you this. Previous studies have shown a similar effect when cells were exposed to SARS-CoV-2 virus. Here we go. But this is the first study to show that the damage occurs when cells are exposed to the spike protein on its own. Repeat. Damage occurs when the cells are exposed to the spike protein on its own. This is April 30th. When was April 30th? 2 weeks ago. A discovery, guys. We know everything we need to know. Whoops. Whoops. Guy Fieri, here he comes. So now, and again, this spike protein, in order for it to be patented, they had to create a version. You guys know what the spike protein is, or am I assuming?
No, you may want to explain.
Right, it's just the sort of outer layer of what the virus and the spike protein, like its name sounds, it has spikes, looks like a little crown. That's why it's called the coronavirus, and it's what allows the virus to kind of gain entry through what's called the ACE2 receptor, and it moves all that material in. Okay. So they feel like, okay, the spike protein is just this first thing that you need to blast with neutralizing antibodies. So let's just replicate that in the vaccine. The mRNA can go into our cells, go into the ribosomal, and instruct, when we make proteins called protein synthesis, instruct our cells to make copies of the spike protein. The idea being we're making the antigen, and now our body is going to see this freaking antigen and go after it, neutralizing antibodies. So we're asking our body to make something that's not good for us, and then we're asking our body to go after it and chase it down. And it's amazing. First of all, let me just say, it's amazing technology. It's very sciencey.
But I don't want sciencey technology.
We can do it. You remember the Jeff Goldblum? Your scientists never bothered asking if you should, like we can, but like, should we? Like I hope that works. Good luck with that. But now that we know that the spike protein runs off the ranch and wanders away from the reservation, that's not good. And that spike protein crossing blood-brain barrier is not the jam, guys. So when they made that, in order for them to get a patent, they needed to make that spike protein really robust because they needed to play with it, right? You needed because the spike protein was pretty fragile in its natural state. We're also getting version 1.0 in the sense that our cells are making the original copy of that Wuhan version. So the variants now are at the point, so now we're going to see, here we go. Brace yourself. We're going to see. I really want to be wrong. I want to just have people be like, you dumbass. Remember what you said about this? Like, I would hope that, because that means that a lot of people aren't going to get hurt. Yeah. I don't want that. I don't want to be like, I told you so. I don't want to be an asshole to people. I don't want to. We don't want to have conversations. But I also don't appreciate being told that I'm a certain way, or I'm going to kill people because that's not cool. Right.
That's not cool at all.
You're an asshole, not me. Because we should be able to talk about science. The science is this fixed thing of, dogma, religion, the science. Like, it stops where you want it. Once the science gets to where we want it, it becomes the science.
The science isn't settled.
Unfortunately, the science keeps going. And I follow science. So on April 30th, science told me something new that the science never bothered telling me. So I don't need to hear it about the science, because I'm not following I'm following science. And it's never going to be perfect, and you're never going to get something right. And it might be great. But this might be a small problem. But to say that to just dismiss it and be like, no, that's not. Do you know how many things when you search and it goes, no, the spike protein isn't. No, I'm sorry, but no, it's condescending. You know how many of these that I got screenshot and archived that I'm just going to dump all over in 3 months? Do they even know how stupid they're going to look? And how many things you got to find in the web archives that. And when you're talking about it as a gene therapy, it doesn't mean that's not a claim that it's changing your DNA. It quite literally, go to American Society of Gene and Cell Therapy headline, COVID-19 vaccine candidates show gene therapy as a viable strategy. COVID-19 vaccine candidates show gene therapy as a viable strategy.
Yeah. It was covers of magazines, and that's
And then there's a lot, and there is a lot of noise.
Yeah.
But what the people are saying is disinformation. You're not going to get anywhere, guys, knocking it down into the shadows. Because what's only going to happen is this stuff is going to feel more true to certain people, even the false claims. And people are going to be talking about it on other platforms. Nobody's able to debate anything. You're only going to make it worse when you hide what people want to ask about. We don't even know what we're disagreeing on half the time. People don't even know half the stuff I brought up tonight. They have no idea. They don't even know enough to even look. I want to be proven wrong. I spent 3 hours trying to disprove some of this stuff because I don't want that to be true.
So
I hate that.
You're saying the spike protein stuff, that's what's going to get us the next round of wickedness.
I don't know. I just know what I read.
What's your prediction?
I just know what I read you, and my prediction is my prediction mostly has to do with what I think the narrative is going to look like, and I know that the competing forces are going to be powerful. So my prediction is basically look for the WHO to really, really, really try to smear ivermectin, and then look for the reports out of India that are using it to be really great, and look for me to be doing side-by-side screenshots that'll probably get taken off of Facebook, but I will be delivering them to you in your inbox. Like when you see, I sent you guys a thing on New Delhi, 10 million people there, right? Choo! That's what I'm predicting is going to happen. What's going to happen when people are out there now with, set up for their immune system set up now to recognize spike protein? What's going to happen? This generation, the next one, what kind of boosters are they going to be doing? I don't know. And maybe I'm too dumb. I'm trying to find like some good counter arguments that make me feel a little better about the spike protein. And then, but again, there's bad information out there, or I should say there's a lot of jumping to conclusions, and I never like to do that. Well, that's fine. But what we need people like you too. I'll talk to, and everybody needs to be able to talk to each other so that we can, people are not, people don't have ideas. Ideas have people. And it's like, what ideas will you allow in? If you can hold two conflicting ideas at the same time, that's what thinking is. I'm able to you can tell me the craziest, reptiles and aliens, and Heidi, I'm never gonna.
I will.
It don't matter to me. I'm not gonna judge anybody on that because I go, all right, let's follow where that leads. Cool. And you know what? In 20 years, I've seen some stuff happen this year where I'm like, damn, there was some stuff that people were telling me 20 years ago that I thought, even in the last year, when we had 15 days of so slow to spread, people were like, some people like yourself and my sister were saying, this is going to last all year. And I was pushing back on her. I'm like, it's not going to last all year. It's just not to, we're going to do this and not overwhelm the hospitals. That was my take. Because that's what we were told, like, don't overwhelm the hospitals. And then it's like 30 days later, 45 days later, 415 days later, and the goalposts kept shifting of what they were telling us.
What would be one of your, nothing diverting, but I'm like Heidi Hopium here. I want to share a little care, bear, love. And for me, I just see there's a way to take your health back in your own hands. Are you frozen? Are you there?
I think he froze. He got overheated over there.
He got overheated. Let me take him out and bring him in.
Down.
Okay, I think he's got to do a log back in kind of thing.
He's coming back.
Here he's coming.
Right. I got zapped. They're listening to me. Do you notice right when it got good?
Of course.
I said aliens and reptiles.
You said aliens and reptiles. That's when they cut you out.
That's right when I got good.
My guys are like, they're not ready.
Look, but this idea that anything should be off the table.
Yeah.
Is bullshit because all that does is it makes it worse, guys. Everybody out there, it just makes it stupid. We can't even talk like grown-ups. We should be able to talk and hash it out. And Heidi, I won't be afraid to tell you, I think that's kind of crazy, but I'm gonna I'm open to be proven wrong. And you
are open to discussion. You've always been open to discussion. Remember 3 years ago, our lunch or something? I go, oh my God. So then two, and then Trump, and then
it was fun.
I was like foaming at the mouth, and you're like,
it was fun.
It was great.
I was lucky. I got to grow up in a family of really lots of diverse opinions and different politics, and I had to kind of be in the middle of a lot of it all. And I saw that what I saw was, well, this person thinks this thing, but I know they're a good person, and this person thinks that completely opposite, but they're also a good person. Most people mean well, and most people might be right. A good idea can come from everywhere. A 14-year-old invented the television. I mean, Or are you a certified television inventor? Who are you to talk? Like, if we listen to that kind of nonsense, like, you're not a virologist. No.
You know, I'm not a doctor, but
here's some people that are.
Yeah. Here's some people that I think the same way.
Did you get that on YouTube? Yeah. Like, why wouldn't I? You can learn freaking calculus on YouTube right now. You could take an Ivy League course on, and like, what's the problem? Like, look at the information and talk about it. This is not the fact that. No, there's the fact that like any of this should be suppressed. If anything, if you really want it to be beat up in the public square, like, let it fly, man. Let's get it on. Like,
that's how I know
over it.
Controlled, because they don't just let it go and let people debunk these treatments. They don't. They hide it and they suppress it and censor it.
Barbara Streisand effect, man.
Yeah.
Barbara Streisand didn't want anybody to know where she lived. She made a big deal about don't tell, I don't want anyone, and then everybody found out where she lived real fast. They would have never cared. When you see, it's like a badge of honor when you see a post got flagged or taken down. You're like, oh, I really want to know what they want me to read. Yeah. I put up a post last week that discussed the pros and cons of a certain topic, and they flagged it and said it was missing context. And then the article that they decided I needed to read to be schooled on that I was missing context. The article that they gave me was a year old. And it didn't even address anything in what I posted. And if anything, what I posted debunked that. Because it had up-to-date information. It had both sides. Yeah. It was literally an article about, let's look at this and let's look at this. It was literally two sides. So as long as the side that they want and the message that they want is out there, then they'll keep it up. And so I'm over it.
And you're saying, though, like, even for such as yourself, people can find the data and the research.
100%. And I'm going to link everybody. I'm going to get you everything. Like tomorrow, I'll put it in a links thing, and you just drop it wherever you need to do. Put it in the description under your YouTube. Put it in your comments.
Can I ask you something though? Yeah. Just wait just a little bit for if anyone has any questions, and Mr. Rick, if you have any questions. Yeah. But I know that your focus as of late has been with the kids. You really and you have been for a long time. You're in kids nutrition and everything. Are you finding any concerned parents lately? Are you finding anyone seeking your advice on vaccines
of course.
and things?
Of course. And
do you guide them to treatments? Or?
I only say is people deserve informed consent. So you are owed a real good global look at all of this. Like, you should be able to see the things I've seen, and I don't make any conclusions for anybody. And I'm not and those kind of things need to be between person and wherever. I mean, they're a doctor or whatever. I don't go into that. People are on their own with that. But if they ask me, or I'm confronted in a situation where I feel like, can I show you something? And again, a lot of this newer stuff, I've had to today. One of the things with this is that I've had to like stress test it. Yeah. Before I'm opening up like this is I kind of catching me at the right time is that I hit the wall where I'm like, okay, I'm nudging up against this because I was open to everything when everything rolled out. And so I was as ignorant as anybody else in terms of like what was mRNA, because I have no idea what is actually going to happen. Because again, it's a clinical trial. We have no idea. And it is different than using a known agent. In the case of hydroxychloroquine, again, it's experimental drug, experimental treatment. What we have right now is an experimental, it's not a drug, it's called a biologic, right? But we have an experimental biologic and an experimental treatment. We have both at once right now. And apparently that's just fine for everybody. But last summer, that wasn't fine when we had a known drug with experimental use for that drug. Like that, apparently.
You're talking about HCQ.
Yeah.
When that was.
So apparently something that was around for 60 years.
Right.
Had a lot of problems
Look how quickly that narrative was shaped, though. That's when you can hold the puppet masters are.
And now now all that stuff I found out Dr. Zelenko was right. He's been vindicated. And yeah, better treatments have come along, but if you could get your hands on that, you couldn't get the other stuff. Why not?
Yeah.
Yeah.
Are you coming across in your daily life out here in Los Angeles? Because he's in Los Angeles too. I'm noticing a lot more people like they're just a shell of themselves. They're like the zombie apocalypse. They're just a little robotic, and they're kind of like regurgitating headlines and not engaging in anything.
I don't know if I've seen it more than I usually see.
Oh, that's true. It's hard place to compare.
Look, it's just easier. It's easier to outsource your thinking to the news and the headlines. Look, not many people. I don't expect my job in the world. I feel, and it's always been that way. Whether it was nutrition or this kind of stuff, is to just be the maniac that's looking at everything, so that I can just give you, some direction. I can look at 500 things, so I can show you 10. Save you some time, maybe try to separate the wheat from the chaff. That's all I'm trying to do, is just put in the work and not have allegiance. I don't have allegiance to political parties or to ideologies. I come in, any good idea can come from anywhere. And when it comes to interacting with people, out here, there's just going to be some people, no matter what you say, forget it. And at some point, it's just like a triage. You're just like, next, who's willing to listen?
Yeah,
we talked about it, Rick. It's like, you say what you're going to say and let the chips fall where they may. Yep. People are going to be open and receptive, or they're going to be closed off.
Yep.
Yeah.
And my thing is I'm not saying what I'm saying is right. What I kind of presented tonight was just things that I saw. And I doubt that a lot of people even saw that.
I highly doubt it as well, because the data is controlled as well of what people.
It's just hard to look when you do an experiment. Certain things. Google search it, and then DuckDuckGo. You're going to a different planet. You're not even living in the same universe. Google clearly. I've done that so many times. I'm like, man, that doesn't even look like I'm looking up the same thing. It's the stuff that they block out. You got to go 20 pages deep. Yeah. I go over to DuckDuckGo. I look it up. I find the articles. I find the journals I need.
Yeah.
I go to Google. I find everything that's spitting in the face of these things. And not the source material, the opinion people. And that's another thing. Go back, CNN, tons of articles, NPR, these platforms that were saying the dangers of rushing a vaccine.
Yeah.
This would be very scary. And if you look at some of those articles, they've amended them. They put in big letters, opinion. Never said that before. Now it says opinion, making sure.
I'm not surprised this entire crisis of the year has come down to another vaccine war, because 10 years ago I was in this war with mothers out here when we lost our medical rights for kids in California. We had all our laws changed, and it became a war. And I realized it was war of mother against mother. It wasn't even like people weren't questioning the data or the science or what's happening to our children. We were just fighting each other. I'm like, I'm just stepping out of that. I'm just not going to participate in that war anymore. And lo and behold, I don't get bothered by this crap anymore. It's just not part of our life. So now it's coming around to this again. And here's this agenda. And I go, it's the first thing to get people fighting, because you're dealing with children and you're dealing with choice.
The mom on mom stuff is funny, because when you have thousands of moms that experience what they experience, people love to talk about your lived experience. Let's honor your lived experience. I want to hear you out. I want to recognize you. I want to validate you. Let's honor your lived experience. And then they tell you, well, my lived experience was this happened to my child. That's my lived experience. You're dead. Like all of these women were pro-vaccination. By definition, they have
because they have one. Yeah.
They weren't people that were anti-vax, like they were people that embraced the science. They were people that went for that.
Yeah.
Believe all women. I don't know. Believe like what?
Yeah.
Like, can
Your
we
body,
not? Because even if they're full of shit, the way they're being treated is unacceptable. You do not run a society by shitting on people that lost their child. How dare you say that?
Yeah.
That you can't even take a second and open up and be like, and validate it. And honor your lived experience. You're full of shit if you say that to these people, but you decide to throw somebody into a bucket that you want to define because it's too painful for you, because it's too hard for you to look at your own issues. It's too painful to think that you've ever done that. Maybe I did something that might have, maybe I didn't do my due diligence. Maybe that's too painful. So they would rather just do a quick, and they gang up and pile on, and you see in the comments, and someone asks a question and they just get shit on.
Yeah.
And it's time that people are able to talk freely and to be treated with respect. Everybody, especially if you're crazy, let's hear you. I don't, because we got to hear it all. If we go,
you know why?
Show it all.
Because we're bringing the human back into humanity.
That's what it's about.
That's what it's about.
Okay. How about, could be right? How about the default being that you don't know? How about being a little humble?
Yeah.
Little humble, a little bit. And I'm actually okay when people go, I'm actually okay when people say, why do you think that about this treatment? And then that person gets to say why. And then they go, well, let me show you what I've found. And that's a real discussion. That's fun.
Yeah.
Name calling is not, that's not my deal.
Do you think the news on India with using ivermectin and the case is completely plummeting? Is that, have you seen it anywhere?
That's what I say. It's going to get good, man. It's going to get fun.
It's going to be juicy.
Because if they have, like, the harder they have to push on the gas pedal, it means that they're not, like they say, if you have to do propaganda, you're losing. Like you can't, it's gonna get.
You have to do propaganda or censoring.
I mean, there's no need for any of that if there wasn't strong pushback.
That's
right.
True.
So, we just need to see what happens, but. I don't know. I just think it's really weird the way people have gotten into these camps, tribal camps, where there's just these ideologies take over, and all critical thinking goes flying out the window, and everything that they say they're about, science, questioning, that's not what they're doing.
That's not what they're doing.
That's not what they're doing. And it's if a platform can be criticized, then okay, like if somebody takes a stance that can be criticized, criticize it properly. When I get these flags and I know that they're bullshit, that's why I'm so mad, because I'm like, that's not valid. I would be, you know what? I would get, at first I was getting excited because I'm like, oh wow, they checked me for misinformation. Cool. I'm going to find something else. I'm going to be proven wrong. This is fun. Because you got to be excited when you're proven wrong. It means you've learned something, and you got a little closer. You're like, cool. Like, and then I look at them like, oh, that wasn't.
I was gonna say, do you ever learn anything from the fake checkers?
Well, a couple times at the beginning, I was like, I kind of jumped the gun on that one. I got, there's been times that I'm like, oh, I came in a little like unprepared, and I deserve to get dunked on. Like, I'm okay with taking my L and getting just absolutely that's fine. And that's happened a couple times, but the far majority of them were like, no, dude, like that's not even close to even what this even says. I didn't even make a claim. When I put the event 201 link, I didn't even put text. I put the link, and it started going all off on me about this was unproven. What's unproven? I didn't even say anything.
Do you want a fun fact? Maybe I can teach you something a little bit. And I've checked this. Event 201, the actual O is actually part of their graphic. It's actually Event 21, which is the Agenda 21 rollout.
Yeah. So we got that, and we got the 25, and we got the United Nations 2030.
It's 30 and 50. Yeah. But
it's all out in the open. It's all out in the open, and that's kind of also kind of like, do you think that they would just put it out there in the open? Maybe. Certainly seems seems suspect.
Seems suspect.
So treatments are available.
Treatments are available.
I can't wait to get you all set up with links and information that people can go to. I would plug one right now that's just awesome to kind of learn. COVID-19, it's the number 1919, COVID-19 criticalcare.com. And all the goodies are there in terms of the protocols being used, treatments, everything that you would want to know in one space.
One swoop. Well, because the reality
about ivermectin.
The reality is, just even ivermectin alone, it could be over. Like, this is accessible. This is cheap. It is, we
could go from a state of crisis to something manageable. And
so that means the fear that what's happening is it's agenda driven, and it just takes more people to rise up to be like, hey, but I just tried this treatment,
Well, they are. Yeah. I mean, they are. And when they do, they conveniently go away, but it's out there and it's happening. And people need to call out, get brave, grow a pair, do things that, like when you find, you cannot, like for me, when it got to the point where I'm like, ooh, okay, am I going to be able to sleep if I can't, last summer with the hydroxychloroquine and me hitting that hard, catching all kinds of crap.
Yeah.
But I knew it in my bones, and I knew the data, and I saw what was going on. There was no way I could hold that back. You feel responsible. And now I'm hearing these numbers. I'm sick to my stomach thinking, what's wrong with these people that all these people didn't have to die? It's ridiculous.
Right.
And everything was it was so sloppy. And I just see one after another, and I just kept having to, someone would send me a link. What about this? I'm like, oh, geez, and I got to go through and, I got this, copy and paste my answer because I got that. I mean, my phone turned into a big frequently asked questions notebook where I kept having to just copy and paste answers because they were just coming in. And I'm like, I can't keep up. I'm one person. I can't beat the media.
But you're making a big dent.
Yeah, I mean, we all have to do it. We all have to do it. And I'm deferring to some people that are way more expert than me. I'm not the expert tonight, guys. I'm reading things from people that have a high level of expertise that are on the front lines. And we always talk about people on the front lines. Let's honor those people on the front lines. Let's give them there are no bigger heroes than people like Dr. Pierre Corey and his gang, people like Dr. Zelenko. And these are the people that they've decided to drag through the mud, the people that are saving lives. It's disgusting. I have no respect for it.
Yeah. Well,
I have no respect for it.
I would like to kind of wrap it up because I know the attention spansies, and we can always do it again. But I would like you to stress some of your number blasts. I know the treatment versus you tell me how you'd like to round out.
Well, I mean,
conversation. And there's one more thing. I just want to show Corey Banks in the house. Fact Checkers is connected to Nelson Pointer, a pointer. Oh yeah.
Good work, Corey. You're the man.
He truly is. Checking the rabbit hole. Yeah.
Yeah. It's always fun, man, when you dig into these institutes. And they're always like, it's like they get names. Just a little pro tip, when front groups were being formed decades ago, so it's always like the Food Safety Council. It's like always like a name that's something that could never be, and it's always funded by, Coca-Cola or something. I mean, these things, there's always some money on the back door, these front groups and these little, you just poke in there. Thank you, Corey, for doing that. Of course, it's always, because you're like, who are these people? Because these people are insane. And I want to meet him in person. Like, get out of your hole, dude. Who are you?
Get away from the
what
hubby
the
hole.
hell is your problem? All right, so here's the thing to sort of, I would just bundle it up like this. There's known treatments that can reduce mortality by 85% or more, depending on in the population that you're in, probably virtually 100%. There's information that you're not being told about the current jabs on the market that you should know, and if you can see that stuff and you still want to go ahead, it's cool. Like that's do you. Mm-hmm. I do not criticize people for their choices, but you deserve to know. If you don't want to know, then that's on you. Mm-hmm. But I would, and again, we'll have. Fortunately, we don't have it right now in real time, but the bias of absolute risk versus relative risk. If you're cool knowing that the absolute risk is 0.7% for Pfizer and 1% for Moderna, if that makes you feel sexy, go for it. Do that. Learn about the spike protein. If anyone tells you that the spike protein is this benign thing, that's a lie. There's new studies that show that. Get familiar with that. Get familiar with the immune system a little bit. Learn about it. Mm-hmm. Also, ask yourself the question why people that were previously infected are not being counted in herd immunity totals for the amount of people that they're trying to get the jabs in. Why? Ask yourself that question.
Yeah, that's a good one.
You still have antibodies, that's ridiculous that you should be doing that. If you don't have antibodies anymore, but you were infected, you still probably have the ability for T cells and B cells to respond. SARS-CoV-1, the original, the OG SARS, is very similar to this. It's not exactly the same, but it's got enough similarities. And they found that 17 years later, they did a study in Thailand, people still had immunity. Natural immunity, no matter what you read, is always best because your immune system gets a picture of the virus, complete picture, and it can basically be trained and conditioned to respond to that. It's always going to be better. It's always going to be better. And what you're seeing a lot of times out there is opposite. It's not.
There's no money in a cure. There's no money in a cure.
And we haven't, we've never had a vaccine. By the way, the Merriam-Webster changed the dictionary. I've got the old definition in a web archive link. They've updated the definition. We've never had a vaccine that would create an antigen in our own body. Now I'm saying that that's not it's really clever, but we don't know. We don't know what's going to happen. You can't say you know what's going to happen a year from now or 2 years from now because you don't have a time machine. And I hope everything works out. I love everyone. I want everybody to come through this. I want health. I want truth. And I want freedom for people. I want people to feel heard. Everyone. Even if you have terrible ideas, I want to hear them. Because it's not what it's about. Any civilization that lasts requires free speech, openness. That's what this country is for. Period. End of story. Truth, freedom, and health will get us there. You can't have these things without knowing what everyone has to say. We are a republic, the people. We don't take orders from our government. We are people. They have to answer to us. It's not the other way around. It's very important. And I'm getting emotional because people are fucking dying. And I don't want any of this stuff to scare people, but I'm also so upset that we know that people could have lived. Yeah. And if the last year, to end this up, my last year's journey hopefully opened your eyes to how things played out and you could see the media narrative where it took us astray, then I did my job.
That's beauteous. Thank you. Thank you, Lawrence. And Lawrence, where can people see you now? Obviously, you're still on Book Faces. We have your
I'm only here for this.
Kids Get Healthy. KidsGetHealthy.com.
KidsGetHealthy.com.
Operation. I didn't put Tone Up on
that's
here.
All right. KidsGetHealthy.com. I got my
it's
information.
On there.
We got OperationToneUp.com on there.
Mm-hmm.
People can reach out to me for consultations through my website, through Kids Get Healthy. Anybody that finds me through this, 20% off of consultations. It's because I have my booking calendar on there. So just say that Heidi sent me and get 20% off on there.
Aww.
And other than that, I mean, that's kind of, that's it. You know, you can add me up on Facebook and direct message me for more. But I think the best thing will just be to provide links of everything that I talked about tonight, so people can just kind of look for themselves and make determinations and find things to debunk it. Like, I want a message in my inbox of why that was completely wrong. I love that kind of stuff.
Thank you for being receptive to a good converson. Thank you for being receptive.
Look at that. I made it through. Like, we all look at that. How crazy. We're all still here. And none of us did it. None of us did anything dangerous. My God, protect me from words.
Rick, what about you? I talked over the whole time.
Rick, you got the floor. Close it up.
So this came from our conversation last night, and all the stuff that you were presenting today, Mr. August, made me even think about it more. It's interesting to me that part of the story out there is that CV-19 can or may not be the flu. And it's awesome to think that we have the hydroxy and the ivermectin that may be able to knock out the flu in a few days versus us having to sit with it for a week. I think that's awesome.
Mm-hmm.
There's good reason to believe it would work against influenza. I mean, COVID is different than influenza. They're different viruses and all that, but the antiviral activity and all that makes sense that it would.
And that to me is kind of cool, because usually, you know, you sit home, you have chicken soup for your flu, and you deal with it for a week. And now it's like, oh, there's stuff out there that may knock it out quicker. I like that. I like that we're getting to those kind of outcomes. That's my 2 cents.
I love it.
Thanks, fellas. Look at how we've grown. We all met in our 20s, eh?
Yeah, like, oh my God, right? And like, think about the things that we thought in our 20s, and I'm like, oh God.
Well, you're still in headphones because you were boom. You boomed for a while.
Yeah, right. Where we last left off, I was holding a boom mic with the same gear. We were shooting on 16 millimeter film. Yeah. So this was all when, and then, you know, everything kind of changed and went to digital. This is like pre-digital
pager days.
Yeah.
Mm-hmm. I think I got the part. I got to call him back in the payphone.
Yeah.
Oh, well, that's my humanly wrap up thing. I'm grateful for anyone who took the time to watch and join and give their 2 cents in here. I want to give a special shout out to the Twitchers out there. I just joined Twitch, because why not? And you got to know your audience. And we got a couple lewd comments I was expecting. And then a couple curious, because you never know who you're going to reach. So
you never know.
You never know. So thank you for coming on. It's clearly getting dark in SoCal. And I forgot my mood lighting.
Well, be good to each other, everybody. And just go into discussions with people. If you want people to have an open mind, you've got to show people that, and hopefully you'll get it in return. We need to be nicer to each other and come together to heal the divide. Mm-hmm. I'm over it.
We need better listening ears. Everybody needs to put on their listening ears and crisscross applesauce and buck up and have conversations.
Yeah.
Bringing the human back in community. Thank you for our hangout, people. I guess we'll wrap it up, even though I want to keep chatting, but we'll do it again.
Cool.
We'll do it again. And thank you, everybody. And good night. Thank you, Lawrence August. Thank you, Rick Ramirez. We'll smell y'all later.
Bye.
Treatments.
Thank you.
Bye.